Thank you very much, State Minister Yamamoto. And good afternoon to the journalists in Japan and across the region. As you have heard, we are here in Himeji for the WHO Regional Committee for the Western Pacific. And I'd like to thank the government of Japan and City of Himeji for hosting this important meeting. The Regional Committee is our highest governing body, bringing together the Minister of Health and senior representatives of the 37 countries and areas across the Asia and the Pacific. That makes up the Western Pacific, which is one of the 6 WHO regions and home to around 1.9 billion people. It includes the world's biggest country and the smallest, and it has a highly developed nations, fast-growing economies, and sparsely populated island states. The Regional Committee discusses important health agendas and agrees on actions by WHO and member states to address them. At this Regional Committee, we're trying a new hybrid way of bringing together government representatives, WHO experts, and partners through a combination of virtual and physical participation. For those of us physically in Himeji, it marks the first face-to-face meeting in 2 years. And to ensure the safety of participants and the host community, we have used a risk-based approach, working with the government of Japan, Hyogo Prefecture, and Himeji City to ensure the highest standard of infection prevention and control. A key topic of discussion this week is COVID-19. In the Regional Committee's opening session this morning, I reported on WHO's actions to help respond to the pandemic, and our Regional Director of Health Security and Emergency gave a presentation on the current situation with the virus and vaccine rollout. I refer you to my speech and Dr. Orowokure's presentation for more details. But this Regional Committee would also address 4 other issues that are important for achieving sustainable development and for implementing the vision for the future to make this region the safest and healthiest region. First, member states will hold a panel discussion on primary health care. Primary health care has always been important, but never been more so than today, with rapidly aging populations and growing burden of non-communicable diseases and infectious diseases threat like COVID-19. We need primary health care system not only to respond to today's need, but to be ready for the future. The second, they will consider a regional framework on nurturing resilience and healthy future generation. The threat that non-communicable diseases pose to health and development in our regions calls for a new approach to school health by tackling risk factors in childhood and adolescence. And using school as a social infrastructure, we can entrench healthy habits in young people, which have a spillover effect into communities and set them up for long and healthy lives. The third is a regional framework for harnessing the role of traditional and complementary medicine for achieving health and well-being. Traditional and complementary medicine is widely used in our region, and like other services, it has evolved and modernized. It offers huge potential for helping to improve health and quality of life as a part of national health system. The fourth item member states will consider is a regional framework to end tuberculosis. Countries in our region once had some of the highest burden of TB. We have successfully reduced infections and death, but we need to tackle new challenges, such as drug-resistant TB and latent TB, and accelerating the progress in order to end tuberculosis by 2030. Before I finish, I'd like to zoom back to the COVID-19 pandemic and how to deal with this virus long-term. Even with our best effort, it now seems clear that globally, the virus will not disappear soon. While we continue to roll out vaccines and implement targeted public health and social measures, we need to expect more surges in cases and make sure health systems are well prepared to handle them and minimize the social disruptions they cause. The Japanese response offers a very good example. Every time there has been a surge in case, action were taken to suppress the transmission, to avoid going over the red line, and without heavy lockdowns, and lessons were drawn and applied to the next surge. This kind of continuous learning and refinement is an approach that other countries observe and apply in their own settings. Japan also showed great foresight with the 3Cs approach, advising populations to limit time spent in closed spaces, crowded places, and close contact settings. This too has become a standard elsewhere in the region and beyond. We are now working with the countries across the Western Pacific to plan for endemic COVID-19 with a focus on protecting the vulnerable and avoiding the red line where health services get overwhelmed. And this requires actions in 5 areas. 1, effective use of vaccines. 2, continued application of public health and social measures. And 3, expanding health system capacity, including home and intermediate care facilities. 4th, early detection targeted response to flare-ups. And 5th, a risk-based approach to border controls. We also need to continue improving surveillance, communications, contact tracing and monitoring, and keep investing in universal health coverage as a foundation, not only for moving towards COVID-19 become endemic, but for ensuring we are prepared for the next pandemic. With the tools available now and the preparedness work we have done, I'm confident that working together, we can get out of this together. Thank you very much.